Hi, I'm Dr. Janine Johnson. I'm a chiropractic physician. I've been in clinical practice for over 22 years. You're watching this DVD because you or someone you care about has fibromyalgia or has fibromyalgia-like symptoms. Many times I've been asked, what is fibromyalgia? Well, fibromyalgia is really an overall body pain. The person feels like they've got the flu 24/7. They have difficulty sleeping. They have difficulty just getting one foot in front of the other. They might have brain fog. The problem with really diagnosing fibromyalgia is there's no blood work, no labs, there's no imaging studies that can be done like an MRI or an X-ray to really help diagnose this problem. Typically, fibromyalgia patients are diagnosed by a rheumatologist who is a doctor, basically an arthritis doctor. They look for 18 trigger points, and a trigger point is just kind of like a hot spot in the muscle. And you have to have 11 of these 18 trigger points to be considered diagnosed with fibromyalgia. Unfortunately for some people, if they don't fall within that criteria, they're told to live with it, they're told they're faking, it's all in their head, just try to exercise more. Well, there is a real cause to fibromyalgia. And what it is it's an overfiring in the upper brainstem, which is also called the mesencephalon. There's three parts to your brain: the upper, which is the mesencephalon, the middle, which is called the pons, and the lower is called the medulla. Typically, the upper brainstem or the mesencephalon fires down to the lower brainstem, and the lower brainstem slows down the upper brainstem. That looping is lost in a patient that has fibromyalgia. This overfiring in the upper brainstem goes down the spinal cord, causes the adrenal glands, and they're glands that sit above your kidney. There are stress handling glands, and that causes the adrenal glands to release cortisol. Again, that's a stress handling hormone. Unfortunately, cortisol is very toxic to the brain. That's why a lot of times people with fibromyalgia have problems with memory. They get kind of the brain fog. So how does this happen? It happens because of stress: physical, chemical, emotional stress. We see it sometimes in patients that have been in auto accidents. Maybe they've hit their head. Like people that have been lifetime smokers, people that have used alcohol in excess. But probably one of the biggest places we see patients with fibromyalgia is some kind of severe emotional stress. Whether it's some kind of abuse, whether it's physical, verbal, sexual abuse, severe financial distress, a divorce. What that does is that stress causes, again, the adrenal glands to release cortisol, and that is very toxic to the brain. The upper brainstem now becomes overfired. This overfiring causes a release of type 3 pain fibers, and that excites those fibers. That causes pain throughout the body. So a fibromyalgia patient might have a headache one day, and then they might have their hip hurts, their low back hurts, their shoulder hurts, their arm hurts. And that's the reason why, is because this overexcitation of these pain fibers. Some of the symptoms of fibromyalgia are difficulty sleeping, again because that upper brainstem is being overfired. We have what's called fibro fog. That cortisol that's being released is very toxic to the brain, in particular to the hippocampus, and that can affect memory. A person with fibromyalgia may have irritable bowel syndrome. The upper brainstem stops you from going to the bathroom, and the lower brainstem allows you to. Again, the break in the connection can cause these problems. A person with fibromyalgia might become light sensitive. Again, in the upper brainstem, the third cranial nerve is housed in the upper brainstem. The cranial nerve 3 helps to constrict the pupils. So when you lose that connection between the upper and lower brainstem, the person becomes more light sensitive. So how do we help these problems? Well, what we do is we look at the whole person. We don't actually we're not really going to treat the fibromyalgia condition, and that sounds kind of strange sometimes when I tell people that. We don't treat the condition. We're looking at the whole person and assessing the physiology and the chemistry of that person. How we do that is through what's called metabolic testing. That's looking at your chemistry. We'll do a complete blood work, complete blood chemistry. Now you might have said that you've had blood work before. You haven't had this kind of blood work. This is comprehensive metabolic panel, complete CBC with auto differential, a lipid panel, a thyroid panel. We're going to look at your food sensitivities. We're going to see if you're sensitive to gluten, wheat, egg, soy, yeast, and milk. And when I say sensitivity, I don't mean that you're going to have a little gut irritation, a little GI distress. You can have irritations or sensitivities to certain foods that cause an immune system response. Stress over time can start to break down that gut barrier. And so things that don't normally get into your bloodstream, like viruses, bacteria, food particles, can now get in. That's also known as leaky gut. And that can sensitize your whole immune system to where you end up with an autoimmune condition. We're going to look at your cortisol levels. Again, because cortisol is such a big part of this, we want to see there's a certain rhythm that should occur with your cortisol levels. We want to see where they are. We're going to look at your immune system. There's two parts to your immune system, Th1 and Th2. It's like the command center and the SWAT team. Command center should tell the SWAT team what to kill off, like viruses and bacteria and things that get into your body. When you have an imbalance in your immune system, the command center tells the SWAT team to kill off things that it normally wouldn't. It could be your thyroid tissue, it could be your cerebellum, which is the back part of your brain. It could be your pancreas. It ends up being what's called an autoimmune problem. We're going to look at inflammation. We're going to look at gut function. We're going to see if there's any pathogens, and we just want to look at the overall health of gut function, because a big part of your immune system is housed in the gut. We're also going to assess you neurologically, and we can do that without the use of needles or MRI. Because there's two parts to your brain, the right and left part of your brain. And with fibromyalgia, there's an overfiring in the upper brainstem. And there's a disconnect in the connections between the upper brainstem and the lower brainstem. So we can assess what's happening through a physical evaluation, and through specific neurological therapies, we can help balance your body, get your body healthier. And that's what this is really all about, is getting the person's body through neurological treatment, metabolic treatment, and getting your body function better and more effectively. We do not take you off medication, we don't prescribe medication, but we want to help you function better, and this is how we do it. What I recommend that you do now is call our office, ask for your free fibromyalgia DVD and report. Also let my staff know that you would like to call and claim your 2 free visits to see if you're a candidate for this type of care. Thank you. I'm Dr. Janine Johnson.